good for sleep. We call it the sleep hormone. So when I check your hormones and your level's low, whether you have a uterus or not, I will give you progesterone. And I use natural progesterone rather than the synthetic progesterone. A few years back, there was a study that came out called the Nurses trial. And in that trial, they were looking for the use of estrogen and progesterone in women who later had breast cancer. And it was found that it was the progesterone component, and it was a synthetic progesterone, that was causing all the problems. So for that reason, I don't use it. And some people still will use it, but I choose not to. Then I look at your testosterone. Your progesterone is a capsule, and you can get it at the pharmacy also, and we send a prescription over there for that. Too much progesterone can cause anxiety and agitation. And so I will have a few women who tell me, I feel anxious now that I'm starting this. Well, the first thing we do is lower the dose. And if you're still feeling anxious, we may leave it off completely if you've had your uterus removed. But if you still have a uterus, we've got to figure out a way that you can take at least 12 days a month of that and protect yourself from the cancers. Now we come to testosterone. Testosterone is available in several forms. That would be an injection or a compound. They do not make a testosterone tablet that I can write you a prescription for and you go to your pharmacy and get it. It's just not available. They do have some creams and gels for men, but not for women. And I haven't had a whole lot of luck with those gels for men on the men either. The disadvantage of those is if you rub testosterone on your skin and you touch someone, you can transpose that to the person you're touching. So I certainly don't recommend it for those who are holding young children or hugging a woman. You know, if you're a man and you've got testosterone smeared on you, you know, that's not a cool thing. So for the women, we offer an injection or a compound. Now, the compound is made by a special pharmacy called a compound pharmacy, and they can put in there exactly what you need. Women do not use near the dose that a man would use, and we talked about this earlier, but a man generally would take 200 milligrams once a week or every other week, but a woman takes 100 milligrams every 4 to 6 weeks. It makes you feel good, and people come by and say, I had my testosterone shot 2 weeks ago, and I felt so good I want to go ahead and get another one. Well, the answer is no. Why? Because too much is not a good thing. Number one, you're going to get oily skin, you're going to get acne, and you're going to start having hair poke out where you don't want hair to poke out. So we have to judiciously monitor your dose of testosterone. An injection will generally last a woman 4 to 6 weeks. You come back by and you get another one. People say, well, how do I know how long I can go? Well, your body tells you. You wake up one day, you're tired again, you just don't feel on your game, and you look at your calendar and think, when did I have my last shot? And that's generally what your body is telling you, hey, I'm getting low again. Now, the disadvantage of the shot is it's going to wear off, and you've got to come back to the office and get another one. Different offices may do differently. In my office, you don't have to have an appointment. There's no office visit. If I have the order on your chart, the nurses know what to do. But the advantage is it works quickly. I give you a shot today, tomorrow you're going to start feeling good, or even later this evening. So there's pros and cons to everything. On the compound, again, I can put in there exactly what I think you need. Generally, I start on the low end because I can always go up, but it's hard to come down on a medication. We send the prescription to the compound pharmacy. We have a couple in our area or several in our area that you can choose from. They make the little mints, they're called troches. You put one under your tongue, and it dissolves in less than a minute. You do it twice a day. The advantage is, as long as you stick that in your mouth regularly, you don't have to come back and see me so often. But the disadvantage is it takes a little bit longer for your body to build up what we call a therapeutic dose, or to a therapeutic level where your symptoms are gone. So I have about half and half in our patient population that like one method and some like the other. They can also, in that little troche, the compound, put your estrogen dose. So you don't have to take an estrogen pill and a testosterone pill. We put it all together and you just take one. They're very cost effective. Insurance companies currently do not cover compounds, but these are very cost effective, ranging under $40 for a month's supply. And you get those. And most of our pharmacies here, if you live away, they will mail them to you. The progesterone is not mixed in with that because progesterone can make you sleepy. And I don't want to defeat the purpose of giving you more energy and feeling good with you being sleepy all day. So you wait till bedtime and take your progesterone. And it does help you fall asleep, stay asleep, and wake up feeling like you have slept. So that's the good thing about that. Now, there's another method I don't offer, but I think there's one or two places in the Shoals that still offer some, called the hormone pellets. And these are little pellets that contain a set amount of hormone. I used to put them in people. I used to use them myself to see how they went. But the main reason I don't use them now is I don't have any control over the dose once it's in you. If you don't like it, or I need to change the dose, I can't get it out. You're stuck with it for about 3 to 6 months. But a small incision is made on your hip, about the same place you would get an injection. And these little pellets are pushed under the skin, and they dissolve, and you have a 3 to 6 months worth of hormone coverage. They're quite expensive, and $300 to $400 for a set, and insurance does not cover that. But regardless of what method you use, you do need to be monitored. So if whoever's treating your hormone symptoms is not checking your blood work, ask them to. You can get too much, or you might need a change of upward in your dose. Most of us in the medical profession were taught to start low and go slow and move up in dose as we need to. And so when you go back, and they say, well, you're on your hormone therapy, and I always ask my ladies, how do you feel? Do you feel like your dose is adequate? Because a woman knows her body better than anybody else. They know their body much better than me, sitting there with them for 15 or 20 minutes, talking about it. They live with it, and so they know. Don't be shy in saying, well, my hot flashes are better, but I still don't have any energy, or I'm still not sleeping well, or I'm still mean, and I need help with that. We'll know what blood to do and what to look for. Now, sometimes you think it's menopause, and it's not. You can have hot flashes, you're tired, you're gaining weight, you're just mean, nobody can stand you, and you can't stand yourself, but you really don't care because something's off. Well, we look at other things. I look at your thyroid gland. Usually women in their over 35, it's not uncommon to start to have a little bit of a sluggish thyroid. And thyroid controls pretty much everything else in the body. So if it's off, that needs attention. And the specialist that you would see for thyroid problems is called an endocrinologist. General practitioners can treat just the basic stuff, but if you have a thyroid problem that's not responding to the basic stuff, you need to see a specialist, and we have one or two in our area that are very good for that. We look at your blood count. Sometimes you come in and we draw your blood, and I always check your blood count, and surprisingly you will be anemic. And I call you and say, you're a little bit anemic. And you think, why? I eat meat, I regularly eating a good diet. Why would I be anemic? Well, I want to know why you're anemic too. And the first thing we're going to do is ask you to have a colonoscopy. If you're not losing blood by a heavy period and your blood count is low, it's very possible that you're losing blood somewhere else. And one of the most common reasons is your colon in your bowel material. And you may not even notice it, but it can be there. And a colonoscopy can be done, and it would show if you have polyps or any abnormal cells. Sometimes, unfortunately, we pick up colon cancer with that, and so that is something we look for. I think we have a question here coming in. I always have to sit up now when she comes in, where I'll know what to do. But we'll see what her question is.
Hello, Miss Dr. Susan Bentley.
Hello.
The question is, okay, she said her sex drive went from 100 down to a 0. What can she do to get it back, and is it related to menopause?
It very likely is. Did she say how old she was?
I think she's 40.
40, okay. At 40, it can be a number of things. Yes, it can certainly be menopause, particularly if she has had a hysterectomy and her ovaries have been removed. Another thing that seriously affects sex drive is stress. So if she has kids driving her crazy, she's raising kids and she's taking care of elderly parents and she's working a job and working home and all that, stress can run it down. But it can be hormones, and a blood test would tell us that, a simple blood test. And if it is hormonal, we can treat that. That is a function of testosterone deficiency. I like, on our lab, normal values are somewhere between 45 and 75. I never want a woman's testosterone level to go over 300, but somewhere between 45 and 75 is the best place for that to be. And it's not unusual. I'll have 40-year-olds come in. I said, I hate sex. I had one lady tell me recently, I don't care if I ever see a Winky again. And that was the way she put it. But her blood level, her testosterone level, was less than 3. So she had no serious amount of testosterone. We treated it with some testosterone, and she is feeling much better now. So don't assume that nothing's wrong that can be treated, because most things we do have an option or two for treatment on that. But again, once you've been treated and you continue treatment, now hormones are just pretty much like everything else. They don't work in the package. You got to stick them in your mouth, or carry through on whatever form you had. It's not unusual. People come in and I know they have a prescription for hormone therapy, and I do their blood work and it's showing no signs of active hormone. And I asked them, I said, well, are you taking your medicine regularly? Well, I never did get it filled. I just kept putting it off and putting it off. Well, it don't work at the pharmacy. You've got to use it and all. If you have concerns about it, I had several patients this week tell me, I know I'm menopausal, I'm having symptoms, but I'm afraid to use estrogen. That's okay. I will never push you to use hormones. As a matter of fact, when I give you your options, I always start with option 1 is do nothing. I tell women, you are not going to die from menopause. You might kill somebody else in anger, but you're not going to die from menopause. So you don't have to treat it if you can manage the symptoms, or if you don't want to use estrogen, if you've had breast cancer or some type of cancer that precludes the use of it, we'll give you something else. Now, my time is getting away from me again, so this is a topic that we could go on and on about. I sat in school several years to learn it, so I can't really tell it to you in 30 minutes, but I wanted to bring you the highlights. So let me recap. Number 1, recognize your symptoms, or listen to the people around you telling you how you need to do something. You're not who you used to be. Number 2, go to your provider, ask for blood work of all your hormones. Number 3, get your results, understand where you are, and go with that, and then figure out what method you want to use. We may have one more question here.
Yes, ma'am. can you still, like when you go through menopause, do you still have a cycle?
No. The actual definition of menopause is the absence of a menstrual cycle for a period of 1 year. So we look at that. We look at your blood level. In my lab, anything over we check something called the follicle stimulating hormone, which is the way we check estrogen. If that number is over 23, you're menopausal. Many times women will stop having a period. They'll come in the office and they'll say, do I still need to use any kind of birth control? Well, I'll draw their blood, and their FSH level might be 150. So no, you don't need to use birth control. Now, it may come in at 24, 25. There's a period right before menopause called premenopause or perimenopause, where some days your ovaries are functional and some days they're not. So during this period of time, until you are truly menopausal, we suggest using birth control. That's how you get those change of life babies when those ovaries are working on days that you didn't think they were working. So my time is up. I could go on, and we may continue this conversation another week. But if you have questions, feel free to call the station and give them the question. You can private message me on our Facebook page. But we want to hear from you, and we want to know what you're wondering about. Just keep in mind, menopause is just a phase of life. It's time to party. It's time for you, and you need to feel good. And that's my job, is to give you the facts that apply to you and let you choose how you use them. Thank you for listening in with us today. We always appreciate you here at the Music Muscle of the Shoals, 105.1, and we invite you to join us again next Thursday at 11 o'clock. This is Susan Bentley, nurse practitioner